Welcome back, my friends. Simona Cochi, The Italian Way, as you can see from the backdrop here. This is a special video tributed to scientific research promoted by Vanessa Carlon, the director of Palazzo Maffei Casa Museum, and the chief of the project. It's a psychiatric and neuroscience project led by Professor Michela is associate professor of the University of Verona. As soon as I received this email announcing the press conference on Progetto Minerva, I said, absolutely, I must report on this research because the group, the scientific group, led by Professor Michela wanted to discover and to investigate and also to delve into the effects of the emotions and the effects, yes, on the mind while watching a piece of art, and how it's positive to visit and to interact with art and its products. So, good morning, Professor Michela Nosè.
Hey, Simona, it's a pleasure to be here. Thank you for involving me in this interview, talking to this important project for the Progetto Minerva.
Yeah, as you know, I'm absolutely interested in art storytelling, but because I think it's important to highlight the positive impact that a body and a mind can get from visiting and interacting with art, also any kind of arts. So how did you conceive this project?
Well, I want to start to the beginning because, psychological well-being. I work in a WHO collaborative center here at the University of Verona. I'm a psychiatrist. And you know that for the WHO, psychological well-being and mental health are defined as an integral part of health. There is no health without mental health. This is the statement of the WHO, that you can find this statement everywhere. But mental health promotion is quite more important for the WHO than treatment the illnesses. And mental health promotion intervention improve overall well-being and could be delivered in various settings where people live, where people work, learn, where people thrive. So specifically in the context of prevention rather than treatment and illness, so in such a public health view, we develop as a WHO collaborative center several projects, international projects and national projects, aim at improving people's psychological well-being with a particular focus. This is very important for us to evaluate the impact of this kind of intervention. So the specific principles underpinning Progetto Minerva are related to all these aspects. So the project aims to investigate how engaging art and cultural experiences in general, specifically through museum visit, as we test in this project, can improve mental health and psychological well-being in general. So the key research questions are how museum visit can affect individual psychological well-being, and how, and this is very important, we can measure this impact. So these are the more innovative part of the project.
Yes, and definitely, how can you measure the impact on technically, I mean?
Well, The most important thing is that this project is a scientific project, and so is constructed in this way. That means that is a project approved by ethical committee, including psychological assessment using standardized scale to measure change in mood, in anxiety symptoms, in depression symptoms, in functioning of the people. So the people who are involved in this project do this kind of assessment before the project and at the end. That means before the 3 visits that are included in the project, the 3 visits of the museum. And all the people involved do this assessment before, at the beginning, at the end of the 3rd visit. And the other idea is that the design of the study is a longitudinal study. And this is the real new thing, because we know that going to the museum have a good benefit for mental health, but we want to measure. And if we want to measure, the only thing to do is to do a scientific protocol, doing with the right way, following a scientific approach. Target population, assessment, outcomes, and it's important to define the outcome before going to the museum, before doing the project.
So which were the major challenges in this project or difficulties that you had to cope?
I don't think we have any difficulties, but it's very important because, we are in a particular historical moment. WHO itself reports that we have seen in the first year after the COVID-19 pandemic in a global increase of more than 25% in depressive and anxiety disorder.
Yeah.
So anxiety, stress, low mood, sleep disorder, generally anxious, depressive symptoms have increased, leading to a deterioration of quality of life and social isolation. So based on this, and also in collaboration with the Palazzo Maffei Casa Museo, the MINERVA project was born. And its aim is not only to create a cultural path within a museum setting specifically aimed at promoting psychological well-being, but also, I've already said you, to evaluate the impact.
Okay, so you can also have different categories in assessing which pieces of art are the most anti-anxiety, or is there a kind of, because art is so different. Sometimes you see in contemporary art, I mean, such an unpleasant maybe design of body of something that you don't like, but they are masterpieces. So which are these effects on the
it's not
mind?
easy. It's not an easy question. It's not easy to find an answer. But we believe that going to the museum improves in general psychological well-being. And when I told you we want to evaluate it, but we'd like to know also if there are some categories in which we have the greatest impacts.
Okay.
Or if there is a categories or in which this is more evident, if there are factors associated with the more impact or not. In general, if we can enter into an international scientific debate on this topic, because from the literature, there is a lot of literature about this theme. From the literature, we know that visiting museums, that art in general can improve. The WHO in 2019 report did a review, a comprehensive review of over 900 studies, in which concludes that arts improve general well-being of people. We know that. And we know also that visiting museum can improve the psychological well-being, building self-esteem, building self-acceptance, self-confidence, awareness of one's value, also feeling of sharing emotional states, cognitive flexibility, self-care, a lot of things. And we think that improving all these things can help people and also reduce the risk of developing mental illnesses. Moreover, and another important point, time spent in a museum is a way of taking care of oneself. We are in a time when stress is rampant and we have time only to do something, not to learn. And so I think that having time is really important. And additionally, if we think in a community level, participating in an experience, artistic experience within a group with other people, of course, promotes social interaction and consequently inclusion in a period in which loneliness is really, really very frequent.
Which will be the next steps or upgrades of Progetto Minerva in terms of publications, more researches or events, presentations?
Yeah, so we began with the pilot phase at the end of May, and with the first group of people, 35 people, this is a pilot. We are waiting for the first result of the pre-post test of this pilot phase. And I tell you, we evaluate with standardized measure anxiety and depression symptoms, general well-being of people, social functioning, and also, of course, awareness of himself, of everybody. So we are waiting for the result of this pilot phase, and then we want to propose consequently after summer to all general population. Another important point, I want to highlight this, is that we didn't offer or we don't want to offer this project to a particular population. We want to evaluate if there is a vulnerable population, but now in this moment, we choose the theme of the visit, of the 3 visits included in the projects, not with a specific attention to psychological themes or something else, but general visit, because we think that the visit to museum itself is therapeutic, is a way of improving well-being. So the idea is that then we want to wait for the first result, and then we can offer to the general public. The project is open to all population over 18. So this is, I think it's really important.
Professor Michela Nosè, thank you so much for your report. I want to be updated furthermore in the upcoming months. And now it's time, of course, to introduce the factor and the major protagonist of the project, the person that thanks to they could develop Progetto Minerva. I'm talking about Vanessa Carlon. Vanessa Carlon, she's the director of Palazzo Maffei, Casa Museo, the outstanding environment in which Professor Michela Nosè has been working on Progetto Minerva. Welcome here with us, Vanessa. We would like to know why and how you choose to support such an incredible scientific project in your Casa Museo.
Thank you so much, Simona Cochi. It's a long time that museums are investigating if there is a connection between well-being and art. So Palazzo Maffei, in collaboration with WHO offices, in particular Professoressa Michela and Professor Corrado Barbui, decided to investigate this theme and to make a measurement, thanking WHO offices and standardized questionnaires to make a measurement of the well-being of people going to museums. Palazzo Maffei is very involved in this theme because it's the story of a private collection closed in a private house, Luigi Carlos, my father house, who is an entrepreneur that has been collectioning since 60 years. He really thinks that arts provides well-being to people, and we really think so. So when we had the occasion talking to Professor Michela that we could make a standardized measurement of the well-being, we decided to support the project. So we opened the museum to this pilot champion of population, and we will open again next fall when WHO offices will call another championship of population of Verona to participate to the new phase of the project.
So also because I've noticed reading your presentation and your outstanding site describing the Palazzo Maffei that you house there, some incredible masterpiece. Can you name it, some of them, the artists that you housed in your Palazzo Museo, Palazzo Maffei?
We have nearly 650 artworks, in particular masterpieces of the 20th century, such as Picasso, Kandinsky, Magritte, Duchamp, Miro, Modigliani, in dialogue between, in a continuous dialogue between contemporary and ancient masterpieces, and also in an atmosphere of an historical palace. It's a Wunderkammer with furniture and applied art pieces of the house.
Wow.
The exposition was curated by Gabriella Belli, a very well-known curator in Italy, and not only in Italy. So she created a path, as I told, in dialogue between ancient and contemporary art, with a chronological development in the first floor and some nucleus in the second floor, meditation rooms.
This is absolutely innovative program inside one of the most outstanding palazzo. I'm talking about the people that are watching us from abroad. Everybody is dreaming on the Italian palazzo, and I suggest you go to Verona and see Palazzo Maffei. So I'm absolutely very happy to have met you today, because we discover incredible news on the benefits of the art on our body, mind, and soul. And I really wish to meet you in person very soon. And yeah, you can know more if you surf on Palazzo Maffei site. And you can also have all the direction and major information on not only on the palace, but also on the project. Keep on staying tuned with the Italian way. Thank you, Professor Michela Nosè, and the director of Palazzo Maffei, Vanessa Carlon. See you soon.
Thank you, Simona.
Ciao.
Thank you, Simona. Bye.
Thank
Bye for
you.
everyone.
Ciao,
Bye-bye.
ciao,
Bye-bye.
ciao.
Thank you.